So my colleagues and myself from One Oncology actually recently wrote about this in JOP, and our kind of takeaway was OCF represents a big advance towards a true value-based care model where they're actually capitating a component of care instead of keeping traditional fee-for-service, which OCM is still centered around. This sounds great in theory, and I know myself and others at least Tennessee Oncology and One Oncology are excited to go towards that next step. But there are a lot of potential challenges with that. We're not used to capitating E&M, and is that going to cause a lot of problems with our billing department and really capturing those patients' visits and communicating that to Medicare? Also, EPROs, patient-reported outcomes. This is a great example. It's a great move forward by Medicare to help really improve the quality of care and make sure what we're doing from our standpoint is actually helping the patient and how the patient looks at their journey. This sounds great. It's worked well at big institutions like Sloan Kettering, but whether this works in the community, especially rural settings where patients might not have access to technology or to really do electronic PRO, still remains to be seen, and whether that's going to be as helpful to patients as we hope, or whether it's going to be even possible and for us to be expected to have to do that in a model remains to be seen. Drug costs are still a part of OCF. I wish they weren't, because I've argued that that's a piece of care we can't control. Parts of it are like supportive care, and I want that to be included, but the therapeutics, the immunotherapies, that's going to be another challenge. So I'd say OCF, it's a step forward. We're on board to go forward with it once we get the final kind of details about it. But I do hope that it remains mandatory. I hope the two-sided risk, which right now is remains optional. The two-sided risk right now, which it's unclear if that's optional for OCM participants. I hope it is optional, because there's going to be a lot of unforeseen challenges as there were with OCM, and we need to test those out before just diving into a model.